So we'll now move on to the first discussion, caring about equality for carers in Manchester. Our first speaker is Abid Mumtaz, who is the head of commissioning for older people, prevention and VCFSE in Manchester City Council. So welcome, Abid. I'll hand over to you.
Thank you very much, Emma. And thank you everybody and for the invite to this really important topic. That's really close to my heart, but also from a work point of view perspective. So like Emma said, my name's Abid Mumtaz. I'm Head of Commissioning for Older People and Prevention for the City Council. I'm part of a team, and as part of our work and remit, we cover an awful lot of areas. And one of those areas, as you can imagine, is carers, hence why I'm here today. So some of the things that we do, I kind of want to touch on that before I touch on the other two parts around some of the challenges, and then also some of what we're hoping to are some of the solutions. So from our point of view and perspective, there's several remits from a commissioning point of view perspective. So the first one is obviously to commission services. And the way I liken this is, it's on several tiers and several levels. With the first one being the carers being at the heart of what we do. Second one is having the carers Manchester over and above and around the carer and offering that help and support. And then wider than that is the wider network that's available to access for the carer, but also for other key partners and stakeholders. As well as this very large piece of work, there's other key elements that have an impact on what we try and do and deliver. So as you can also imagine, internally we have the carers assessment statutory service. So that's a process that we do internally. And over and above that, there are other services that we try and commission as well as we possibly can, given the environment that we're in, and that's things around carer short breaks policies, for example, and procedures, as well as provision. So from a commissioning point of view, we try and follow a process and a pathway, something that we call a commissioning cycle, which is around being able to analyse, plan, secure and review. And I'll touch on some of these key parameters throughout this discussion. That's the first part as my introduction to myself, but then also to us as a team. I kind of now want to touch on some of what Emma was just saying, but also what this year's Carers Week is trying to shine a light on. That's around equality, and that equality is on several levels, and Emma's clearly touched on some of that, and it's around health disparity, health inequalities. Reduced mental health, employment, as well as education, and what differentiates us in Manchester to other parts of the country. It's, I suppose, on several levels. It's again our demographics that we have, given and geography of where we are. So obviously we're based in the north. We have a very vibrant population, but that also has its downsides with regards to ethnicity. From a health point of view perspective, we know certain ethnic minorities have certain conditions, so therefore there has an impact. So therefore there's an increased prevalence of carers because of that reason and rationale for it. And then there's also a national perception of certain communities behaving in certain ways, but then how can we try and scratch below that surface to see what those needs are? Again, becomes really, really challenging. And it was also interesting when we listened to Emma when we talk about census data. I suppose that is one of the key things when I was in preparation for this is around that data, that information that we have. It isn't as strong as we'd like it to be. We always refer back to certain elements of this research has told us this, and the outcome is on certain levels. But what we would like to strive towards in Manchester is having more accurate data. And that accurate data on equalities, inequalities, to be able to prove a point, to say these are the needs of our Manchester population of unpaid carers. Because if you don't have that underlying benchmark, it's really difficult to be able to then give services to meet those needs. Because if you don't know what the needs are, it becomes really challenging. So that there's a couple of things that we are hoping to do that will help us get us over that line. So as a As a collective, we're part of the MLCO, which is an integrated way of working across statutory organisations where we can try and pull resources and be able to raise a profile of what we're trying to do on a day-to-day basis, but then also as a collective. And I touched on some of my tangible elements of my role, but some of the intangible roles are exactly that. So whatever forum I go to, whether it's carers related or not, I will always bang the drum of actually what's happening. You know, what are we doing more of? What can we do more? What can we do more of? What should we do more of with regards to unpaid carers? And ensuring that we're not forgot about with regards to, as from a system point of view and layer, rather than it just being a contract that we manage on a regular basis. It needs to be much, much wider than that. We have an awful lot of assets in Manchester, being able to pull on them from primary care, secondary care, as well as community services to say, what are you finding with regards to your local population? How can we amalgamate all of that data and information that we're getting across the networks that we're hearing into one overarching strategy, which then puts me on to what we are hoping to achieve in the short term as an authority is to do exactly that, of having a unpaid carer strategy that we can set over the next 2, 3, 4 years. This is what our aims and objectives are collectively. It can't be and won't be something that comes from myself or us as an organisation. It needs to come from grassroots. So it's what we're hoping to do and achieve is a co-produced strategy where we work with partners, where we work with stakeholders, and more importantly, we work with unpaid carers to say what's important to you as an individual, to your community. What can we do with regards to offering that help and support? And then beneath that is ensuring that there's an action plan and working through that action plan that captures a lot of what's already in what we're hoping will already be in the strategy, to say the strategy has told us this, and the action plan therefore has to be chunked into this is what we will do, because what we don't want to do is to write a co-produced care strategy and then do nothing with it. It needs to be tangible. It needs to be one of those documents that is live, that people hold us to account for, and where we are able to work across partnerships, where we can hopefully have increased investment into this area, but then also that the increased awareness of work that we're doing around unpaid carers, but then also being able to plug those gaps around data, being able to highlight other things that are happening across our communities, to say from a signposting point of view, these are some of the things that we're hearing are working in other parts of the country, and what can we potentially piggyback on and do differently here and amend. Emma's appeared, so I'm guessing that's my time to be quiet.
Pretty much, yes. Thank you, Abid. If you can have another minute if you want to.
Yes, thank you. And just to round that up, so I've been in the authority for just under a year, and I've worked across several different demographics. Across majority of it is across the North and the Midlands. The key part that I'd like to stress that we have in Manchester are, well, a couple of bits. First and foremost, from an authority point of view perspective, I can wholeheartedly say that we care. We care about unpaid carers, and we care about making a difference. And that's just not from an authority, but also from the partners that we're going to hear about from and also much wider than that. Thank you, Emma.
Lovely. Thank you, Abid. Really interesting to hear from you, and a great start to the discussion. So I'm not sure if the Q&A works, but if it does, if anyone has any questions to Abid, you can post them there. And after we've heard from the next speaker, we'll have some time for questions and answers then. So then next we'll hear from Ben Whalley, who is the Chief Executive Officer of mental health and carers charity Gaddum. So over to you, Ben. Thank you.
Thank you, Emma. Can people hear me okay? The yellow square, yeah. I mean, that's great. Okay, thank you. And again, to echo Abid, absolutely just incredibly grateful to be invited here this week. I think one of the important things I want to stress, and like any of these, this week is a really important time for raising awareness, but actually this is something that people we're all dealing with day in, day out when we're carers. And so just to acknowledge that from the very beginning, but there's a lot of amazing activity going on this week to raise awareness, but it's about keeping that going and keeping that traction going as we move forward. So I don't want to repeat anything that my colleagues have said so far. Emma's done a really great summary of the demographics in Manchester and the census data and things like that. And Abid has also talked about Manchester City Council and how commissioning works What I want to talk about is kind of focus in on equality and what we do at Gaddum, but then also where we can all go to try and make sure that unpaid carers are supported and ultimately can live equitable lives and that they aspire to. That's the really important one, because many of the services are often, I think, that we experience when we need support can often feel led by the service rather than by our own needs, really. And that's certainly not the case in the context of Manchester and carers services across Manchester. So in terms of Gaddum, as Emma said, we are a mental health and carers charity. We've been in existence since 1833, and ultimately our belief system hasn't really changed. We believe that people have the right to have equitable health, wealth, and self, and that's for every individual and community that we work alongside. Underpinning all of that is that we often hear, particularly in around Manchester and other populations, almost being referred to as the high prevalence needs or acuity and kind of how serious certain needs are. But actually, we believe that all of those individuals and communities have the solutions already within them to get through the issues that they're facing. And so ultimately, we need to support stronger individuals and communities. On top of that, and links with our views around partnerships, Gaddum, we're an anchor institution for the voluntary community, faith and social enterprise sector. And ultimately what that means is that we don't think one organisation delivering everything is the solution. We think that it's about a partnership approach of many organisations that people will feel more safe and comfortable accessing, rather than being signposted to one that does carers or one that does mental health. That you have the people should be able to walk in the door of where they feel comfortable and get a service there that they will benefit from. We work across Greater Manchester and other areas of the north as well, and again furthering our charitable mission around improving the lives of people experiencing mental health and people who are unpaid carers. And I suppose moving into kind of the theme for this week, equality, it's such an important point for us to reflect on, really. What does it really mean? Because there's all sorts of different notions and different ways that people speak about it. Is it treating everyone the same, or is it treating everyone differently? As far as our approach at Gaddum, we believe in equity and in treating everyone individually completely differently based on what their unique needs are, really. In other words, how a person identifies and how a person aspires and where they want to be is where we will start to engage with people around. And it's funding from organisations, commissioning institutions like Manchester City Council, like the NHS, like other local authorities, that make our charitable work possible. So that's a really important point to make. Data is an issue. And so one of the things that we also believe around equality is properly understanding what the needs are and working with individuals across Manchester based on those needs. Now, that's a really important point, because people can often be referred to as hidden communities and things, which is a real frustration of ours. Actually, it's more about services being hard to access. So one of the fundamental things that we do is try and flip that on its head and make sure that we are properly engaging with people who are across Manchester and who may need that support. But there is data that we do know about. So we do know about the just shy of 40,000 carers that the census estimates, but actually, as Emma's pointed out, that data is much higher than that. We know that people prefer to go into services that they feel comfortable walking into, as I've already said. So what we do is work in partnership with our amazing Manchester Carers network partners to make sure that their doors can remain open as well, really. We know that children as young as 3 and adult carers in their 90s are the kind of the age range of people who are providing unpaid care to someone who wouldn't be able to deal with their day-to-day life without that support. We know that women are more likely to be carers than men, and carers are more likely than other populations to experience mental health distress and also severe financial distress as well. So there is also a lot of data out there, but I fully agree with my colleague Abid in the City Council around making sure that we improve that and start to make more informed decisions on it. I just want to go into support for day-to-day things then. So we work with people through the contact point and on the ground, and we work with across Greater Manchester 40% of the Greater Manchester population to provide tailored support that is based on what an individual aspires to, rather than be led by the worker or by the organisation. That's a really crucial point. But then what we also do is influence. So using data, but also using our charitable approach. Our principles of co-production around lived experience and around sharing power are really, really important to us. No decision about me without me, and the autonomy of carers to have breaks, to not be carers, and to have career aspirations and other things is also something that we will support individuals with as well. And ultimately, we recognise through our workforce, through our own lived experience, that we are all, and we could be carers throughout our life as well. So at the heart of everything is co-production. Just before Emma cuts me off as well, is the third part of what we do at Gaddum, which is we campaign. So last year, many may remember the government was looking at benefit caps around carers allowance. They're ongoing looking at benefit cuts and return to employment. And myself and others at Gaddum were on national stages. We were being interviewed in the news. We were really kicking off, I suppose I'd say, around how inappropriate that was, and just highlighting simple things but really powerful things, like if we were to understand the cost of what carers are currently doing on a day-to-day basis nationally, it would cost the same as the entire NHS service. And so just recognising and respecting unpaid carers nationally is a really crucial one. So in summary, what we do around equality and around unpaid carers at Gaddum is we support, we influence, and we campaign. Thank you. I'm sorry I've gone over time slightly, but I'm more than happy to take any questions as well.
Lovely. Thank you, Ben. That was really interesting to hear as well. So we'll now move on to Q&A. So over to you, Eve.
Thanks, Emma, and thanks to Ben and Abid for your speeches. Throughout the discussion, anyone that's in the chat, please feel free to put things in the Q&A box if you have any questions. I'll start with a question that we've got for both Ben and Abid. The theme for Carers Week is caring about equality. What support is your organisation offering to tackle the disparities and disadvantages carers can often face to ensure a fairer society?
Shall I go first? So I don't know when that question came in. I don't want to repeat myself, but fundamentally for Gaddum, it's one of co-production. In other words, people being understood and being heard, and also being empowered to be able to have the aspirations and make the decisions that they want to be able to be where they want to be, really. So very, very much that is about engaging with an individual from a completely person-centered perspective. So our expert staff will engage with individuals where they are, whether that's in crisis, whether that's reaching out for support, or anything in between, to find out what people are wanting or needing, and then being able to kind of identify steps to get them there. Just on a strategic level, it's also about understanding through data that again Abid mentioned as well, the communities in Manchester that we might not be reaching. I hold my hand up. I'm a white British middle-class man. I am not the best person to speak for anyone other than me. I only have the lens that I look through, really. But it's in sharing power and decisions with others who are more representative of the communities of Manchester, that is going to actually see a more diverse and better represented service offer, really. So twofold, really. It's around understanding where the data is, but also providing service to individuals where they are, really.
Thank you, Ben. And from my point of view perspective, it's on three different levels. So I'm going to put them into three blocks of assumptions, knowledge, and evidence. So first and foremost, what we can't do, and what I refuse to, is make assumptions about certain communities, carers, unpaid carers, our population. It needs to be driven by knowledge, via the data. I'm being driven by an evidence-based approach. So what does the data tell us about our population? And also with regards to what does that needs assessment, and how does that inform our strategy with regards to what do we need to do next to be able to tackle the underlying issues? Because if we don't know what the key underlying issues are for what populations that we're trying to serve, it becomes really, really challenging. And I've been working with Gaddum really closely on a couple of elements, which is an awful lot of this. So they're working on a piece of work for us as a partnership around equality, ensuring that services meet the needs of our all of the population rather than some of our populations. And they can only do that via what Ben just articulated, co-production, but then also to scratch service and look at what's actually in the community rather than a blanket assumption being made of, I believe our population needs to put something into place. It needs to be a case of actually what's our population telling us, what's that data tell us, and then what's worked elsewhere as other parts of the system and country that we can potentially use to improve outcomes for our residents and population.
Thank you guys both so much for that. My next question could be for either one of you, whoever you think could answer this better. What can be done to ensure that the voluntary services are able to have affordable premises to base their activities in?
Can I just come in first a bit, but maybe you want to come in as well from a commissioner's perspective? One of the really important points that I think is we need to make, and certainly I was another discussion earlier today on another in mental health as well, really, and this came up. The voluntary sector in Greater Manchester is under pressure like never before. In fact, between 2012 and 2022, £100 million each a year. The voluntary sector is £100 million poorer than it was in 2012, really. Now, that isn't because commissioning authorities have said that they don't think the VCFSE sector is any good, or it's actually down to austerity and real pressures with partners like Manchester City Council around funding organisations. So I just want to preface that we have a really strong relationship with Manchester City Council and with other commissioning authorities. And we work really closely to fully understand the costs of delivering services with them so that they can then commission in turn. But we're not naive as a voluntary sector to the pressures that the City Council are under.
Thank you, Ben. And then from my point of view and perspective, it's on a couple of levels. So we know that the national drivers that haven't helped with regards to some of this. So around the increases in national insurance, which wasn't taken into consideration with the cost of voluntary sector, which then adds an extra burden on, and if you can't afford to pay your wages, and premises obviously come hand in hand. So there's that part of it. And then the other part I was thinking actually when I was listening to the question was, is that wider part of around what we're hoping this week will go over, and it's that quality with regards and equity unpaid carers from a financial point of view and perspective. How much do we save the economy of being able to care for? Because and I always equate this to our home care provision. So if someone doesn't have a unpaid carer and they're entitled to a care package, a home care provider goes in, I'd say a cost. There's a cost attached to that per hour, but unpaid carers, they don't have that same cost attached clearly. So it's us being able to shine a greater light on that, especially in Manchester with the political spotlight that we have in Manchester. Actually, look, from a local point of view and also a national one, this is what we saved the system. These are some of the tangible outcomes that we have across the system. So therefore, what can you do to help us with regards to some of those underlying costs? And please take us into consideration when you're doing things around national insurance contributions, for example. But then also, what can anything be released nationally that can help the voluntary sector, but also unpaid carers to be able to tackle some of this from a financial point of view and perspective? I think that's the best way that we can potentially do that. And being in Manchester, I'm hoping that becomes easy because of the political spotlight that's always on the city.
Great, thanks. And another question for Abid. Are there plans to reduce the current waiting time from point of referral to having a carer's assessment completed?
We're always looking at that. So we have a dashboard that we explore on a monthly basis, and that's reported into our governance structure again via a formal governance process. We've recently invested in additional staff to be able to achieve some of those targets. So to answer your question, yes, we are hoping it comes down, but if it doesn't come down enough as we'd like it to, then that's another case of being able to go back to the authority to say what can we actually do different. But answering yes, it's something that we are hoping will reduce, but then also over and above that, it's also something that we track on a monthly basis.
Thank you.
Great. Thank you, everybody. That's been a really great start to the webinar. So thank you, Ben and Abid, for your contribution this far. We'll now move on.